Hello, my people. Let's quickly talk about this. Many times, some people have gone to hospital for one problem or the other, and after some initial evaluation by a doctor and some tests conducted, you see some people abandoning treatment or leaving the hospital with a conclusion that after the evaluation, nothing was found to be responsible for what is happening to them, and so it's most likely a spiritual problem or the reported village people at work. Well, this video is not to argue your belief about the existence or the potency of spiritual attacks or black magic or the role of the village people in causing what your problem is. This is to help you understand what could have happened, why those tests has not been able to come to a conclusion of what is wrong, and what should be your next step, what should be your guide. When you come to a hospital, either you're seeing a doctor on outpatient basis in the clinics, or you've been admitted in the ward or through the emergency, there are things you must get your doctor to answer for you to help you understand what your problem is, how to establish it, and how to get treated. One, at the end of any consultation or admission, your doctor should be able to tell you what is your diagnosis. You must demand to know what you are being treated for. Okay, this will help you to understand what is going on. And this diagnosis can be from clinical diagnosis, from what the doctor feels or found after listening to you and examining you, and could be supported by the lab tests or other images like X-ray, ultrasound, CT scan, and so many other images that are not commonly in our everyday hospital consultations. Secondly, usually if a diagnosis is made, until that diagnosis is confirmed, there are a list of other possibilities that the doctor considers. This we call differential diagnosis. That means if the diagnosis is not correct, if it's not exactly A, it may likely be B or C that is happening to you. Okay, so you need to know this. Let the doctor tell you, okay, we think you have this, but after our investigation says there's a possibility it may actually be this or that. Okay, you need to know this, because when you know the line of thought of your management, you'll be able to follow in decision making, and your decision is very important in consenting for things to be done by the treating team. And thirdly, you need to ask the doctor what specific laboratory tests or imaging like X-ray, ultrasound, CT scan, MRI, or a special test like a biopsy and histology, where they cut a part of your tissue and send to the lab. What specific form of these tests will confirm categorically what is wrong with you, even if these tests are not available in the hospital where you're being treated. Demand to know, because sometimes they may think you will not be able to go to bigger hospital. Okay, we can manage with what is here and all that, and they think they are helping you. But if you have full knowledge of what is going on, what the intentions are, what are your best options, and where you can get them, you may be able to make some hard decisions, raising money probably to go to bigger hospital and get properly diagnosed and treated. So you need to demand this knowledge of these possible special tests that will establish what is wrong with you. And fourthly, you need to know what is the likely outcome of what is wrong with you. Am I going to die? Could it cause maybe kidney failure? Could it make me lose my sight? What is this something that is going to resolve after some time, with or without treatment? And what is the timeline of these expected outcomes? Is it something I should be worried in a matter of hours or days? Is it something that can give me months to prepare and get treated? So the expected outcome, the likely complications will guide you in knowing how hasty or where you need to go and seek help. So if you have knowledge of all this, if you are carried along in these decisions, you may likely have better understanding and conclude that what is happening is not spiritual. Meanwhile, it could just be that the special tests that should establish what's wrong with you are not available in the hospital where you're being treated, and so that test has not been done. Lastly, let me add that all that is to medical treatment is not malaria and typhoid. When you go to hospital and you do malaria tests and you do typhoid and they come out to say is negative, it doesn't mean that it has ruled out all medical possibilities of what is happening to you. So demand to be carried along in decision making, demand to know what is wrong with you, what else it could be, and how can that be established. I will be sure that by the time you follow this, you demand referral to the best centers where you can get treated. We will start having less of these incidences of, oh, we've gone to hospital, nothing was found, it has to be village people, and we are losing people with potentials to avoidable deaths because the right treatment was either not gotten or abandoned along the way to alternative causes which were yet to establish their potency. So this is just what I want to clarify, and you can leave your reactions at the comment sections. I will be able to attend to them. And this is Dr. Tony Arium, adding to health and social literacy. Thank you.